This is chapter 18, Alterations in Cardiac Function. So I'll be looking at different heart diseases that would include coronary, endocardial, myocardial, so that's the actual heart muscle itself, pericardial, and congenital. Okay, CHD, or coronary heart disease. Now this is the key word here, coronary, which lets you know it is the blood vessels of the heart. Okay, this is what actually nourishes the heart tissue. So coronary heart disease is also known as ischemic heart disease. Another name that's out there is coronary artery disease, or CAD, okay, coronary artery disease. Okay, the patient is basically dealing with decreased oxygen, which is ischemia. So the fancy word for decreased oxygen is ischemia. To myocardial tissue because of atherosclerosis, which is a coronary artery disease. All right, this is where the inside of your heart blood vessels have been filled with plaque and all that. So I'll just draw a picture here. Okay, the black ink represents the plaque buildup, and as you can imagine, just by looking at this picture, as blood is flowing through this particular tube, you're going to have diminished blood flow right there in the middle. Just by eyeballing it, we'll call that 90% blocked. And this means you're decreasing blood flow, so therefore you're decreasing oxygen. Okay, if you have decreased oxygen to heart muscle, you will have heart issues such as dysrhythmias, which is abnormal heartbeat and abnormal heart rhythm, cardiac arrest, which is sudden loss of blood flow, and then chronic heart issues. Okay, so heart failure, so chronic heart issues to pump blood to meet the body's demand. Okay, so there's an inadequate oxygen supply and demand there. Okay, dysrhythmias is also known as arrhythmia. And with cardiac arrest, the sudden loss of blood flow can also contribute to failure of the heart to pump, and this would be due to electrolyte issues or decreased oxygen. Okay, a lot of ingredients are needed to pump the heart, right? You need oxygen, you need calcium, you need sodium, you need potassium. Those are in the electrolyte family. The oxygen is a gas, the rest are electrolytes. How does one get coronary heart disease? Or okay, the most common reason is atherosclerosis. And that was that picture we drew earlier of the buildup that can take place inside of a blood vessel or coronary blood vessel, so atherosclerosis. Respiratory failure. Okay, decreased perfusion. And if you have that, then there'll be a decrease in blood volume. So that the fancy word for that is hypovolemia. Okay, there can be a decrease in blood pressure or hypotension. Okay, if a person is experiencing too low of blood pressure, then there's not enough pressure to actually perfuse the organs. So in other words, the heart, which is a pump, needs to squeeze hard enough to push blood into organs and tissue. Okay, so if there's not enough pressure, then you can't even perfuse your organs or tissue. If there's decreased blood volume, so just not enough blood in the body, same thing, you're not going to have an adequate amount to perfuse organs. Okay, abnormalities in microcirculation. And micro errors in the endothelial behavior of the heart and blood vessels. So these micro errors, here's a picture of that just to give you an idea. So this is blood vessels that surround a heart. So dye has been put in the blood vessels. And you can see how the heart tissue, the cardiac tissue, the myocardium would have a very rich blood supply. And tubes taper from big to small. And so the diameter, the more proximal, the bigger the diameter, and the more distal you go, the smaller the diameter. And this gets into what is considered microcirculation, especially at the capillary area. So metabolic control, gas exchange, nutrient exchange, okay, all that stuff gets into the microcirculation. So if there's injury to the tiny capillaries, so abnormalities, then the endothelium, and going back to something that we covered in ANP1, atoms and molecules, if you have enough of those, you make up organelles. And if you have enough organelles put together, then that makes up the cell. And if you have enough cells, that makes up tissue. Enough tissue makes an organ, and then your organ system, and then the organism. So if you want to hurt the organ, then create those micro errors. Okay, then you'll hurt the organelles, which means you'll hurt the cell, which means you'll hurt the tissue, which means eventually the organ is hurt. Okay, risk factors for cardiovascular heart disease is age, family history, genetics, epigenetics. All right, hyperactive oxidation of cholesterol. Okay, we're going to talk about that in more detail in a minute. That's why I have so many asterisks beside it, because that's a very important topic. Obesity is a risk factor. Hypertension, diabetes, diet and lifestyle issues, smoking, drugs, toxins, and chronic infections would be some examples of risk factors for cardiovascular heart disease. Injury because of atherosclerosis. Okay, sclerosis means hardening of. All right, so this is where the blood vessels become hardened. So how do you do this? First, you piss off the endothelial lining of the blood vessel. Remember, there's 3 layers to our tubes, right? The inside is endothelial lining, so simple squamous epithelium. Then the middle layer is the muscle layer, so the tunica media. And then you have the outside layer, the tunica adventitia. So the inside lining of your blood vessel, the tunica intima, these injuries to the endothelial lining are due to a lifetime of deficiencies, okay, so nutritional deficiencies, and the risk factors that we listed above, so obesity, chronic infections, smoking, and all that. Okay, so after you piss off the endothelial lining, the second thing that you should do is tell cholesterol to do its job. And it's plus, you're going to activate cytokines and other inflammatory mediators. Then you're going to activate the oxidation of cholesterol. Then activate foam cells and other growth factors. Then in number 3, allow this to continue over time. Usually it takes decades to start hurting the heart blood vessels. Change nothing in your life. Do not change diet and lifestyle. Change nothing. Avoid checkups, avoid physicals, avoid annuals, avoid labs. Ignore all advice. Then eventually you're going to go see the medical staff at the hospital. So the hospital staff will likely save you or stabilize you. Then you'll get discharged, and then repeat steps 1 through 6. Okay, so let's talk about what tests All right, first, and these are in no particular order, is the VAP test. Okay, now in order to understand this, you'd have to understand that there are subparticles to cholesterol. Okay, let me explain. Normally, a lipid panel is ordered. Okay, so that includes LDL, HDL, triglycerides, total cholesterol, sometimes VLDLs are in there. And so that's the so-called lipid panel. All right, but what is not ordered are the subparticles of cholesterol. Okay, VAP stands for vertical auto profile. And this measures the different lipoprotein particles or cholesterol particles that are inside of us. And this is a patient education chart or handout that helps people understand the different types of subparticles. So here's an example here, an LPA. There's one in particular that the VAP test, also known as the LPP test, which is lipid particle profile, we'll look at, is called the LPA. Okay, the LPA and the ApoB. These are, especially this one, the LPA is 10 times more atherogenic than the LDLs that get the bad press of the bad cholesterol. Okay, so we're going to talk more about that in a minute, but LDL, they like to say, is the so-called bad cholesterol, and HDL is the good cholesterol. Okay, but I'm going to explain why that's not the best way of saying it. Okay. Okay, so first is, so let's go, we're going to come back to those charts. Okay, so we're going to jump down here. So this is the pathogenesis of plaque formation. So the first thing that you need is an injury. So you need to do things like to chronically hurt the endothelium. So hypertension, smoking, toxins, viruses, okay, all these things that create inflammation in the body, on top of decreased nutrition. Okay, decreased nutrition would include low levels of CoQ10, low vitamin C, deficiencies or low in B6, B12, folate, okay, serine, which is an amino acid that is needed for protein synthesis, metabolism, neurotransmission, methylation reactions, and so on. choline, which is vitamin B4 and is necessary to help with tunica intima health. Okay, you also need B1, which is thiamine, and omega-3s, which is an essential fatty acid. Okay, you need vitamin A, D, E, and K, especially the vitamin E and the vitamin D for healthy blood vessels. That allows them to maintain their flexibility and allows, okay, all these together allow the blood vessels to expand. So think about this. When every time your heart beats, it pushes fluid through your arteries, which means the arteries have a bounding effect, right? They pulsate, which means they expand, which means there's some stress, some hemodynamic stress to your blood vessels. So you need that tunica intima to stay healthy and strong so that it can withstand that hydraulic pressure so it doesn't crack or fissure or tear. And that's what happens. So the blood vessel, the intima starts to tear, and then the body activates all that inflammation stuff that I mentioned earlier on those different steps on how to, my recommendations on how to hurt the tunica intima. So here so now the person is experiencing endothelial dysfunction and your white blood cells, so leukocyte adhesion and monocyte adhesions, and all of these platelets and all these things start to come in to repair. Okay, so that's the goal. There's an injury and your body is trying to repair it. Now, what happens is the layer between the tunica intima and the tunica media starts to fill in. Okay, you can see it here. It starts to fill in with new cells, new tissue, scar tissue, and then lipid starts to get deposited. So you get your fibrofatty atheroma. And where does that come from? LDLs. Okay, that's why LDLs get the name bad cholesterol. However, in more recent times, we're trying to move away from that language of bad cholesterol, and instead of blaming everything on LDLs, we're blaming it on inflammation and decreases in nutrition. All right, so the standard American diet, lots of sugar, highly refined foods, processed foods, artificial flavoring, your food colorings, like all these toxic and things that are found in food, that's what's getting into people. So they're nutrition deficient. They've got all these inflammatory things going on. And as time goes by, it creates damage to the tunica intima and it leads to this. Okay, so that's actually what's to blame. But for forever, we've been blaming simply the LDLs. That's the bad cholesterol. It's like, well, they're actually just doing their job. Okay, here's another picture of that. You have here's the lumen. Okay, so that's the actual area where the blood circulates through. So that's, if you look down the barrel of a tube, that's the lumen. All right, here's your endothelium, and that is the simple squamous epithelium, but there's an injury. So there's injury and inflammation. And look at this. LDLs are going to come in and they're simply going in to repair. right? Now, in order for LDLs to become activated, so there's your oxidized LDL, they have to come into contact with inflammatory things like interleukins and cytokines and our macrophages. Okay, your macrophages are going to allow the LDLs to go inside of it. So there's your lipid uptake. And the macrophage produce what's called these foam cells. And the foam cells, if you use a construction analogy, it's like laying down wet cement into a pothole. Okay, so the truck just simply unloads all that wet cement and it's filling the pothole. But in this case for us, it's filling the area with um, an extracellular matrix. So new tissue is being produced. We get proliferation of smooth muscle. The foam cells keep depositing their plaque. And that's it, because it's supposed to be a patch job, right? We've got injury, we're trying to patch it, but the problem is it doesn't stop. Why does this not stop? Well, because the person continues to hurt themselves through what they're eating, their diet and lifestyle, nutritional deficiencies, and this process continues until you get this atherosclerosis and this plaque buildup, and then it gets to the point where it is, if you look down the barrel of a tube and we have all this um, fatty infiltration stuff, now we're dealing with, 90% blockage or 95% blockage or whatever the person's number is. And this is very, very risky and very dangerous because it can cause a heart attack. Okay, let's go back to the top. So in this particular section, what I would like for you to know is that we have different subparticles to cholesterol. It is the oxidation of the so right here, number 5, the oxidation of the LDLs that create these foam cells that go in and deposit this plaque stuff. Okay, so inflammation is to blame, and then diet and lifestyle stuff. Okay, these are other. So all these are just patient education handouts. So these are handouts I have in my clinic. These are tests I run on my patients. And then depending on the results, depends on the treatment. Okay, so if you notice a reoccurring theme here, all right, low fat diet and exercise, low carbohydrate diet and exercise, low carb exercise, aerobic exercise, low carb diet, exercise, low carb diet, and exercise. Okay, niacin, omega-3s, niacin, omega-3s, niacin, omega-3s. So you're starting to notice a reoccurring theme that is through all these. In other words, diet and lifestyle becomes important. And at the very least, a person should be on niacin and omega-3s. And then watch what you eat. Okay, so on this next one, this is another patient education that I hand out to my patients, and we go over whatever their labs say we're going to go over. So for example, if their labs come back with high cholesterol, then I go over this with them. Okay, it indicates hyperlipidemia requiring possible investigation as to why. Okay, why do you have high cholesterol? Is it a side effect of medication? Is it dietary factors? Is it genetic? Like, what's going on? Let's say a person comes back with high triglycerides. All right, so then we get into so LDLs become a target of therapy. Patient with a 0 to 1 risk factor are recommended to target LDL cholesterol. What is metabolic syndrome? Okay, there's 3 traits to this: abdominal obesity, elevated blood pressure, and the third one is a high fasting blood glucose level. Okay, so that is a very unhealthy 3 characteristics to have. That's called metabolic syndrome. If C-reactive protein comes back positive, well, what does that mean? Well, it's an inflammation marker, and combined with your lipid particle profile can have a 4-fold increased risk of cardiovascular heart disease. And so depends on what is read to the patient, depends on what comes back positive on the labs. Okay, so then after we go through patient education, then we'll get into, okay, what medications are you on? Because they do cause nutritional deficiencies, and then here's your potential health problems. Okay, so what I do with this is if you are on an antacid, then you and I are going to read, so like Prilosec, for example, we're going to read this together, and I'm going to tell you, because you're on this particular medication, B12 deficiency, and here's what that's going to cause: anemia, depression, tiredness, weakness, increased cardiovascular risk. Okay, it also causes a folate problem, which can cause birth defects, heart disease, cancer risk, vitamin D deficiency. Here's your side effects. Calcium deficiency. Here's your side effects. Iron deficiency. Side effects such as anemia, weakness, fatigue, hair loss, brittle nails. Zinc deficiency. Weak immune system. Poor wound healing. Decreased sense of smell and taste. Sexual dysfunction can come from zinc. So when people see this, they're like, yeah, I've got that and that and that. So we mark it. We mark all the things that they claim that they have, okay, based off of a side effect of the medication that they're on. If they are on antibiotics, okay, here's your nutritional deficiencies, your B vitamins, vitamin K, what that does to your gastrointestinal tract. Different cholesterol medication. Okay, that one inhibits CoQ10, which causes various cardiovascular problems, weakens your immune system, and low energy. So we're not going to have time to get into every single one of these, but this is here for you. If you are on any medications, I would read, here's the medication you're on, what deficiencies it's causing, and then potential side effects because of the deficiencies. Now, once we've established that you have certain deficiencies, then we try to reverse that. Let's get you undeficient. Let's get this back into your system. Okay, so it's a very good chart. It does take time to work with your patients on this, and this is one of the reasons why, generally speaking, in Western medicine, people don't really do this, because it definitely is going to take longer than 6 minutes. Okay, to sit down and work with your patients for a good, healthy, long-term game plan to turn over a new leaf and get healthy again. So this one with micronutrients role in heart disease. So all this gets into is what happens when people are deficient. Okay, so heart disease kills more Americans. 1 in 3 currently have some form of heart disease, and micronutrients and high blood pressure. So high blood pressure can result in physical damage to the walls of our blood vessels. That's what I was alluding to earlier with that hydraulic pressure. Micronutrient deficiencies can worsen the condition. So zinc, copper, calcium, magnesium have been linked to deficiencies in this have been linked to high blood pressure.